right now on News Channel 8 Today.
And good morning once again, everybody. I'm Paul Mueller. The opioid crisis has become a national epidemic. It certainly is hitting home in two Bay Area counties. Manatee County had the highest rate of fentanyl-related deaths in 2015, and neighboring Sarasota County also in crisis mode. So what else needs to be done and who can help? This morning, our sheriff's roll call. Manatee County Sheriff Rick Wells and Sarasota County Sheriff Tom Knight. Gentlemen, thanks for joining us this morning.
Paul.
Glad you're here in the studio.
Thanks for having us.
Before we dive into the epidemic really quickly, I really want to get your take on what happened, what has been happening in Charlottesville the last couple of days, Sheriff.
Well, I mean, it's just a horrific event. And when you see the video and the footage of what went on, it's disturbing. And it just reminds us of the dangers that are out here, not only for the public when you have these type of protests, but also, you know, for the law enforcement officers. You know, we had 2 state troopers that died as well trying to cover this story, and their helicopter crashed, unfortunately. But, you know, it reminds us of how important it is for us to continue to train our deputies.
And Sheriff Knight, I mean, how do you prepare for something like that?
Yeah, we train all the time, like Rick said, and we definitely want to de-escalate things when we can. And we know our community, our analysts will tell us who's in that community, who's at the events. And if we see somebody that's at the event that doesn't look like they're part of our community, we'll confront them and have a discussion with them. But like Rick said, it's disappointing. We live in a free country, and First Amendment is valuable to us as citizens. And for people to express the First Amendment rights without having something catastrophic happen is disappointing.
Just terrific images to see that car into the crowd. All right, let's get to where we are today for the topic for our roll call, the opioid epidemic. And what do you think is making your two counties hotspots, Sheriff Knight?
You know, it's a difficult question to answer, and we wish we had that. It may go back to when we had our oxycodone, our pill mills back in 2008, 2009, when we were able to shut down the pill mills, the residual effect of the opioids. But we have our analysts working on that, along with the nonprofits in Sarasota County, to try to better identify and understand when we discuss with an overdose person what drove them to the opioid and where they're getting it from, but more importantly, what their desires were to have it, to try to get a better understanding of why Sarasota County is experiencing this.
Sheriff Wells, you find yourself up against the same thing, because we know this is a national epidemic. It's not just happening here in the Bay Area.
Yeah, that's right. I truly believe that the epidemic started once those pill mills were shut down. That's the timing that I'm looking at. When you talk to people throughout the community, they were hooked and addicted to opioids. And when those pill mills were closed down, we left them with no alternative. There was no help for them. They were out there starving to feed that addiction.
It's cheap.
Absolutely.
It's cheap, much cheaper than the prescription painkillers that they were on. They couldn't get the scripts anymore.
And Paul, like Rick has just, Sheriff Wells has just said, is when we were able to get those pain clinics shut down, the need for the opioids, the one thing that we didn't see was fentanyl, is that as law enforcement, we can handle the heroin, we can cut off the stream of the heroin, but the fentanyl was a game changer. We knew we would probably see some type of illegal substance coming in when we were able to get the pain clinic shut down, and that desire of that addict to have that continuing desire for the opioid, but we never saw fentanyl until a couple years ago.
And you're right, that fentanyl really came as a surprise to a whole lot of people. We'll talk about that. You know, it's another legal opioid, 10,000 times more potent than morphine. That can kill someone on contact. And I know, Sheriff Knight, your office actually charged someone with murder in a fentanyl-related case. Are you trying to send a message with that case?
Well, certainly, sending a message is one way to look at it. It's a proper charge, but I think the message is there. Like you said, certainly we want to send a message to the dealers and the traffickers, and I know Sheriff Wells and I talk a lot, is that, you know, the addicts, we want to get help. It's the dealers and the traffickers we want to get to stop distributing it. But when you're dealing that and you know what you're dealing, fentanyl, you know you're dealing with a drug that's potentially deadly. And so for us at the Sheriff's Office, it's almost like Russian roulette. You're putting that gun to their head, you're spinning a cylinder, but you're still going to sell it to them with the hopes they don't die. If we can trace it back and find out where we dealt it, we're going to charge them with murder.
Russian roulette, indeed. You know, Sheriff Wells, let's start with you on this next question. Both of our counties are also dealing with the foster care system being affected by opioid abuse. And how far have you gotten, or what are you doing to kind of address that problem?
Well, you know, in Manatee County, the Sheriff's Office handles all the CPS calls in that county, so we are responsible for keeping these kids safe. We had over 400 children that were removed from their homes last year. We have the Safe Kids Coalition. We have the Florida Youth Ranch in Manatee County, who is now taking these kids into their facility. The important thing is we've been able to keep the siblings together. We're just trying to keep them protected. The first thing we need to do is remove them from that situation. They are being neglected, and we have to help them.
Well, Sheriff Knight, just think of the situation we had in Winter Haven. I believe it was this week, where we had two kids in the back seat, the woman overdosed in the front seat, and just 2 days before that, Winter Haven actually officially trained their officers to administer Narcan.
Narcan, yeah, and we started using Narcan nearly 2 years ago now, and we've had over 114 deployments, and we've only had 18 people die since our intervention efforts have started on the streets, and saved a lot of people's lives with it. And we're seeing that become more prevalent out on the street now. We're seeing schools have it in the schools in case of the children who touch the fentanyl by accident. So certainly from a standpoint of the children, like Sheriff Wells says, we're seeing nonprofits step up a little bit more now and beyond DCF, and to be able to keep the siblings together and to do better with the children.
Just something to go off of what you just said, I want to talk about Narcan.
Yeah.
And it's not available in schools anywhere in the Bay Area. This just came out of my head. Do you think that Narcan should be available in your school districts?
I think with the epidemic is going on right now, it wouldn't hurt to have it. Certainly the paramedics and EMS are going to arrive there, but we've been very fortunate that each deputy carries 2 doses of it and is able to administer it at an overdose location when they're dispatched. But certainly to have an ounce of prevention around doesn't hurt.
And Sheriff Wells, you know, we know that seconds, minutes, but in this case, seconds can mean the difference. What are your thoughts on that?
Oh, absolutely. You know, when we began to experience this epidemic, I think Tom would tell you the same thing. We were not responding to these overdose calls and getting there first. EMS was always arriving. They were there. They had the Narcan. Times have changed. Things are different now. Our deputies are finding people that have overdosed in parking lots and bathrooms. Narcan is a valuable tool that we all must have if we're going to save lives.
All right, we have about 50 seconds left for this segment. The last question is, how are you able to help addicts that your deputies encounter in these potentially dangerous situations, Sheriff Knight?
Well, it's unfortunate now we've become more social service type of agencies along with our law enforcement.
Right.
And we have addiction recovery programs in our jail. I have 96 individuals in my addiction recovery programs inside the jail now. When we experience an overdose, when we go to the hospital, we're able to give them information for an intervention to try to get people into recovery, to let them know who the recovery providers are, the nonprofit providers. But the jail itself, it's very unfortunate now. We look at our jail for the opioid addicts as a first form of intervention, and they get inside and we get them cleaned up and they want to volunteer to get into recovery, and we've seen great successes with that of getting people's lives straightened out.
Sheriff Wells, Sheriff Knight, we'll ask you to stay with us for a moment. We're going to stop the conversation there for a moment, but coming up, we want to hear from you. Head over to my WFLA Paul Mueller Facebook page and post your questions for the sheriffs. We will pick a few of them to ask. Keep it right here. We'll be right back. All right, welcome back. We continue our conversation this morning with Sarasota County Sheriff Tom Knight, as well as Manatee County Sheriff Rick Wells, and we're going to turn to some of your questions you sent in on my Facebook page right now. Linda Davis, first off, saying, that's so sad that young people turn to this drug, and she wants to know, Sheriff, how are we failing so many young people? How are we failing, or is the family failing, or is this just them with the addiction, which is the disease?
I believe that we have stopped educating our children at a young age about the harmful effects of all drugs. If you go back in time, you look at the DEAR program, you look at some of the educational programs we had in our schools, well, they are no longer there. Budget cuts have removed them from the normal teachings that we have always been involved in. And I think that the educational component that we once had is hurting our children because they are not being told how harmful these drugs are and how to stay away from them.
So, Sheriff Knight, you know, I'm reminded when you're talking, Sheriff, about Nancy Reagan. Just say no.
Just say no.
It brings me back all these years. We're cutting the funding for these programs for kids.
And the schools get used for everything, so it's hard to get in. But we were in the schools a lot in 09, 10 with the oxycodones. The children then were having pill parties with the different pills. So it's
Putting
the same
them all
thing.
in a big jar.
Put them all in a big jar
And
just pulling them out. And like Sheriff Wells said, is that we haven't been in those schools of late, and the education is there. Maybe the education for the parents is that ultimately resides with the parents or the guardians to educate their children. Maybe they're just unaware of what's going on. How they cannot be now, what's going on in our communities, I don't know, but certainly the education value is missing.
Let's hope the awareness can come in. Okay, another question from one of our viewers, Deborah Sue Orszewski. She wants to know if you utilize regional task force resources to address the issues, and if so, what agencies?
Well, we work very closely with the DEA. We work closely with the ATF. We're on the FBI task force, and that's what we're doing on the law enforcement side to put those drug dealers in jail. That's the important thing for us. We always talk about we're not going to arrest our way out of this problem. This is true, but we are going to hold those that are selling this poison out here accountable. So we have made several arrests, and we continue to. There's always someone willing to step in their spot, though, and take over. Which goes back to Sheriff Knight, the case that you're using right now. Not to serve it as an example, but to put out there that that kind of behavior won't be tolerated.
We're hoping it reaches out to those people who are dealing it, and kind of like Sheriff Walls said, we're with the United States Postal Service. You'll see something come out this week where we made a very big hit with the United States Postal Service assistance on some carfentanil. Served some search warrants yesterday, and we're able to arrest some people to keep that off the street. So it's a multi-pronged approach to get people healthy again, but enforcement leads the way with it.
Okay, so Deborah Sue also wanted to know if you use psychological professionals, as well as what are the financial implications when it comes to resources. So do you use psychological professionals on this? Well, we have, counselors, and we have a recovery pod as well in our jail. We have counselors in there, faith-based. We have people on the streets that are going to the homes of addicts that we know have overdosed 3 or more times, trying to assist them, get them the help they need. So we don't have all those resources available to us. Tom and I are using everything that we have. The medical side is done through the treatment facilities, and we try to get them to the professionals. All right, let me ask you one more question. Laura Bob writing in this morning on our Facebook page, can we arrest our way out of this mess or treatment? So basically what we've been talking about, jail or rehab, what do we do?
This is a societal issue. You are not going to arrest your way out of this problem. No. And as Rick knows, Rick and I started back in crack cocaine, and that was a violent drug. It was in inner city area. This is widespread. Our youngest overdose victim is 18. Our oldest is 73. It's all
73.
Over. 73 years old.
So 18 to 73 is the age range. 73 is
the age range. And an interesting point about this is, as criminologists would tell you that crime was going to drop when we hit a recession, it didn't. We continue to drive crime down. My crime is still going down while we're having a societal problem.
Do you find the same thing, your crime trend going down? Absolutely. We have a 10-year decrease in crime in Manatee County. This problem has not gone away.
Crack cocaine crime was violent.
You know what? I was going to ask about that. That was crack cocaine. We're talking back in the, if memory serves me correctly, back 90s, in the 80s, right?
Cocaine cowboys, and he was on an interdiction team, and we all interdicted it back when we were young police officers.
And so you guys have been in the area for a while. So have things gotten worse?
Absolutely.
This is the worst drug I've ever seen. I tell my wife this will be around when I retire if society doesn't do something about it. We're here as part of the solution, but it's not going to be resolved totally with law enforcement.
All right.
But listen, Paul, real quick. As bad as crack was, we didn't have the overdoses that we have today with the opioids and fentanyl.
Let's hope we can make a dent in this. All right.
Sure. Thank
Sheriff
you.
Knight,
Sheriff
Wells, thanks for joining us this morning.
Well,
All right.
Thank you.
Thank you. All right. We're going to have much more coming up this morning. Our report from Tallahassee. We'll be right back. Keep it here.